One of the best things about the medical mission was the amount of people that we were able to help and touch their lives. And not even the people that did get healthcare, but even the people we were able to just talk to outside of the mission that were hanging out around the hospital, just talking to them and listening to them. Everyone wants someone that is going to listen to them and relate to them. And I feel like our mission gave so much to the Philippines, but the Philippines also gave so much back to us. Just to think of how many lives were touched through that, it's absolutely amazing.
I was part of a team that was responsible for the EMR, the electronic medical record. I think we're able to give the hospital a safe, systematic way to store patient information and hopefully make it easier for them to follow patient care. So from the patient name to the date of birth, the address, but also incorporating information about the service that they received or the surgery, medications could be input there as well. So it's just keeping patient information in one central location. So when we first got there, there was paperwork everywhere, piles and piles of paperwork. So the first thing we did was separate all the departments, separate what the patients were coming in for and the days they were coming in. So we're able to systematically go through everything, enter it into the system, and not have to dig through pages of paper as the patients were coming in. We also got the patient's age, their date of birth, their sex, how far is the patient traveling from, how long does it take them to get to the clinic, just helping to prep for the next day and information needed. We ended up registering on day one at about 600. You think you've seen the world and you think you've traveled, but there's so much out there that you just haven't experienced yet. And there's something very special about the Philippines. I fell in love with the people and I fell in love with the place.
What you see, you can't even prepare for that. You can't imagine what you're going to see. The thousands of patients that are lining up just to talk to a doctor and to seek advice, it blows your mind. The patients and the people in the Philippines are so patient. Over there, they will sit all day and wait just to talk to you for 5-10 minutes, and they are the happiest people once they get to talk to you. There was this one patient, she was a young 1-year-old girl, had a very severe cleft palate and cleft lip malformation, and they went in on surgery for her, and it was about a 6-hour surgery. But when she came out, she looked completely different. She had a full frontal lip, her teeth were no longer sticking out, and it was just amazing. And to think how much this girl's life has changed from this surgery, and she doesn't even know yet. All of the opportunities she now has in life from receiving that surgery, it really touches your heart and opens your eyes to everything that's out there in the world. I did get a chance to go to post-op and the PACU, where they were right after surgery, to see these patients. And the Filipino patients are so grateful and so kind and so happy for anything you can do for them. They were amazing to work with, amazing to talk to and to hear their stories. It was just life-changing. I have a different view on the world from going to the Philippines from that mission.